this be visible?
No, it's okay. Thank you. It's a live studio. We thank you for staying with us on the Ultimate News and the Current Affairs program on television. I told you at the beginning that it's loaded. Well, we'll kick off our conversation segment with the members of Association of Community Pharmacists.
Traffic congestion is avoidable if we all obey traffic rules and regulations. Stop the recklessness on our roads. Stop the carnage. Obey traffic rules and regulations. This message is brought to you courtesy Independent Television and Radio.
A million apologies for that snatch. I mean, it's a snag as a matter of fact. It's TMI Monday. We get our conversation segment on as we look at the World Pharmacist Day 2021. And so we have with us in the studio two executive members at the state level of Association of Community Pharmacists of Nigeria. Dr. Allen Iboy is the vice chairman. We also have Dr. Sam Ian, who is the secretary. Thank you, gentlemen, for coming on the program.
You're welcome.
Okay, let's begin. What is the purpose of this day? What does it mean to the average pharmacist?
Okay. The World Pharmacist Day is very significant to the average pharmacist because it is a day where we celebrate ourselves and then we also reflect on the impact of pharmacists in public health, and also it's also a day that we will have opportunity to appreciate the general population for the trust and confidence that they have reposed in pharmacists over time. So the day was set aside by the International Pharmaceutical Federation. So all over the world, September 25th, which is actually on a Saturday, we had to come here because Saturday was a weekend.
Okay.
So it's a very significant day, and all over the world it is being celebrated. The impact of pharmacists in public health, and then we also have opportunity to celebrate ourselves, celebrate excellence in professional practice, and then basically that's it.
Okay, let's talk about the theme of this year. How relevant is the theme of this year to the current challenges that we have in the society?
Okay, let me come in there. Thank you very much for having us today, and really it's a happy one that we are celebrating the International Day of Pharmacists, the World Pharmacist Day 2021. And our theme this year is the trust that the public have reposed on the pharmacists.
Okay.
And pharmacists, your trusted partner in health. And that theme actually is very important, very germane at this point, where we see the general trusts of the public in the healthcare, even in government in general, has really gone down the drain. And then especially in the time of COVID-19, the information out there, people are confused, people are not so sure of what exactly to do, even in terms of the vaccination. So at this time, we really want to state that the public has reposed their trust in the pharmacists, and pharmacists have proven to be one of the most trusted healthcare practitioners as it is today. And we also want to use this opportunity to tell the government if they can find a way to partner with the pharmacist in terms of vaccination. Because if you go out there, you see the way the public, when it comes to their healthcare needs, they head to the pharmacy first, even before they head anywhere, because they trust this set of people to believe that they will give them the right decisions about their health. If this set of people can give them a particular idea, you do this for this vaccine is trusted, you can take this vaccine and all of that, and you believe the people would key into it. Okay. And if the government can partner with us in the long run, you would see a very good turnout.
Okay. Yeah. Quick comment on it. In addition, do you have any event planned for today or has the day been observed? Because you said a while ago it's 25th, yeah.
Okay, quickly, World Pharmacist Day 2021. The theme is pharmacy, always trusted for your health, and the emphasis is on trust.
Okay.
At this time, there is a dip in trust. Trust in societal leaders have really waned, mainly because of this period of pandemic. And of course, what we are saying is that over time, in national surveys, pharmacists remain one of the most trusted healthcare practitioners. And then at the community level, community pharmacists render services directly to the people within the community. And over time, that trust has been built over a long time of excellence in professional practice. And we are saying that we can put that trust to use by way of advocacy and partnership with all relevant stakeholders, especially government. I recall that there is a very high level of vaccine hesitancy all over the world.
Yeah.
People are actually uncertain. But I want to tell you that many of these persons have a very high trust in us because they are patients, they come to us, and then they want to find out from us what they want to get information from us to be able to make informed decisions.
So you're saying, in effect, that the pharmacists are not being carried along in all of this?
Rightly so, because pharmacies, especially community pharmacies, render services at primary care level. Yes. They are more or less like the first point of call for most persons in the community. And over time, these people have come to be very comfortable with accessing primary care services at this level, and that trust has been built. So we are saying that if community pharmacies are carried along, are incorporated into primary health care, are incorporated into vaccination scheme. It's also important to mention that many pharmacists has been trained and now they are certified vaccinators. So we have a lot of them coming to us to ask us, what's your opinion about the vaccine? Should I take the vaccine?
Or shouldn't I take the vaccine?
Should I take the vaccine?
Yes.
So we can serve at that level by providing advocacy. Advocacy, not only for vaccination, for disease prevention, for public health, and then most of these activities that healthcare covers at primary care level.
All right, so I think we'll just leave it at that, but let's get a final word from you as we call it a wrap.
Okay, permit me to say, in addition to what he has said, in developed climes, as we all clamor for international best practices, in developed climes, you find government partnering with pharmacies. I'm sure if you listen to the news, you hear community pharmacies are at the forefront of vaccination. And you notice the increased level of vaccination in places like the United States and all of that as a result of the public being able to access these vaccines readily at community pharmacies. So if that can be brought down, or the same thing replicated in our country, I think there will be a very beautiful. And also it will be important to say that community pharmacies have been rendering primary healthcare services for over the years, and the patients have trusted this set of practitioners.
Okay, all right. Yes. Let's leave it there. I'm sure that in the days to come, we'll be able to have more conversations along the lines of community pharmacy practice, and then particularly within the context of the COVID-19, because people are saying, look, pharmacists are the problem, especially the big pharma, Pfizer, Johnson & Johnson, Moderna, AstraZeneca, name them. But that will be a matter for another day. Thank you for coming, Dr. Allen. Thank you for coming, Dr. Sam. It's the TMI Monday. We'll take another break. We'll be back with you in a moment.